right. Good morning.
Good morning, how are you?
Yes, I'm here to see Dr. Workman or Madeline
What was the last name?
Grant.
Okay.
My name is Lateesha Grant. Can't wait to get this done. So I have to take my time to get up. I'm a phlebotomist. I'm always on my feet constantly.
Lateesha came to see me, well, she hobbled into my office because she could barely walk.
How you doing, baby?
She's a 49-year-old with really, really bad degenerative hip disease. She'd been seen by her primary care doctor. I think she'd even seen another sports medicine doctor, and she was referred to me for surgery.
I was in a patient's room drawing blood. Then all of a sudden I heard a crack. I thought I broke my hip. And then the pain was like, the pain was like 10. Excruciating pain, and it was on both sides of the hip. It got to the point where I could not walk. My boss told me about TPMG. Dr. Workman looked at my x-rays.
She started to develop what we call hip contractures, to where she found herself almost falling over because her hips were so degenerative. But generally, when people come to see me and they're ready for surgery, they've already tried anti-inflammatory medications, physical therapy, often cortisone injections, specifically with hip disease. And she had exhausted all those efforts.
He said, you're gonna need surgery and stuff. And I agreed to it. All right.
This is your second go around.
And there is my, that's me right there. I'm gonna be bionic woman. It saddened me that I didn't have no cartilage. That hurt me. I'm like, how did I deal with that pain for 2 years? The joints lock up. And when they lock up, you can feel the grinding. It hurts. It affects my family. My family members feel the pain.
Good morning.
Hi, baby.
Hi.
How you doing?
So good to see
So-
you again.
The beautiful thing about my practice is that we sit down for the first time we meet each other for the surgical consultation, and then you do come back for your pre-op visit. And at that pre-op visit, we're able to sit down and go over expectations on which medications are going to be needed, what frequency, why are we doing certain things. So the more that we're able to sit down together as a team, because this is a team approach, the more anxiety and the more the stress decreases. Hey.
Hi, Dr. Workman. Hi. How you doing? Yes.
This morning.
Okay. It's a pain.
Oh, I know.
I'm ready to
Round
go.
2, right?
I'm ready. I'm ready. From A to B to Z, he explained everything, and I was happy. I was really happy. Hi. How you doing? I'm ready to go for surgery. Hi, Dr. Workman.
Can you move your foot up and down for me?
Okay.
Any questions for me?
No.
Okay, we'll get you a matching set today, okay?
Hey, Lateesha.
99% of my surgeries I do from a direct anterior approach, where it's a very small incision on the upper thigh. And what's so great about this type of approach is that it's muscle sparing, or what we call minimally invasive, to where we're actually not cutting any muscle when we go right down into the ligaments that are right in front of the bone that we need to address. Hey, how you doing? Look at you, wide awake. A lot of hip replacement surgery has become outpatient, meaning that you either go home the same day of surgery or you stay overnight one night at a hospital and leave the next day. We're able to do the surgery pretty judiciously, and then you're up and walking immediately with therapy.
All the way up. Perfect. Good job. How does that feel?
It feels good.
Awesome.
I'm feeling at my best. I feel young. I'm ready to go back to work. I feel good. He did a great job. It's beautiful. And he works with such technique. I'm like, wow, I feel no pain.
Lateesha came for her first post-op and she's doing extremely well. She's using no cane or walker, and it's been only about 2 weeks, and it's been just an incredible journey to see her do so well with the right and then just be so elated with the left.
I love these doctors. They're the best. I wouldn't ask for anything else. It's amazing. I want people to know it's young people who could get this problem as well.
I think that there's a stigma that you're too early for joint replacement, but it's not worth suffering today and not having a good quality of life to worry about the future.
The after effect has been rewarding for me. I love it.